Hello, my name is Dr. Julian Barwell and I'm a consultant in clinical genetics at the Leicester Royal Infirmary and senior lecturer at the University of Leicester, carrying out research into the causes and management of inherited cancers. This podcast is about the Supporting Families with Cancer project. Patients are usually referred to their regional familial cancer service because a number of their relatives have been diagnosed with a tumour, and it's been suggested that these may have been caused by an inherited trait or altered gene. In clinic, we take a family history and are often able to offer a blood test to determine if an affected member of the family has inherited an alteration in a cancer susceptibility gene. In our experience, patients with a family history of cancer are commonly unaware that there may well be an inherited link and can sometimes struggle to obtain a referral to see a geneticist. As a result, opportunities to offer genetic testing to determine the cause of their family history of cancer, screen at-risk relatives, and consider risk-reducing strategies such as preventative surgery are frequently missed. Our patients have often grown up with cancer affecting a number of their close relatives, which can make decision-making over genetic testing psychologically challenging. Occasionally it can be helpful to talk to other patients who have been through similar experiences and to talk to local and national specialist support groups. Because of our concerns about the support families with cancer are given, we have developed the Supporting Families with Cancer project, which is a partnership between Macmillan Cancer Support, the Leicestershire Clinical Genetics Service and GENI, the University of Leicester's Genetics Education Centre. In this partnership we have a number of existing patients who have very kindly offered to talk to any new patients who are keen to chat to other people who have been in a similar position before. We have developed a psychotherapeutic and medical psychology service for patients deeply concerned about the impact of cancer on their family. We've also developed community and hospital projects to raise awareness of inherited cancers, particularly in families where there have been at least two of the following 3-2-1 criteria. 3 affected relatives with the same type of cancer diagnosed across 2 generations, with at least one diagnosed under the age of 50. Apart from this, a number of our cancer patients have told us that their support during their surgery, chemo and radiotherapy was very good, but they had felt very isolated when they were no longer being treated in the hospital every day. They felt they had little opportunity to understand why their tumour occurred, and what they could do to protect themselves and their family in the future. As a result, we have developed the medical supermarket model, whereby at the end of their surgical, chemo and radiotherapy treatment, patients have the opportunity to attend a weekend or evening event with clinicians and researchers. At these community engagement events, patients can attend talks on the latest medical advances and meet geneticists, dieticians, physiotherapists, local and national support groups, counsellors, smoking cessation, cancer prevention and research teams. The hope in the future is for patients and their families to use these events to learn about their condition and their available health choices, and in turn to commission their own healthcare in a similar way to a supermarket. To date, we've had a focus on the use of aspirin and curcumin to prevent cancer, fatty liver disease and the link between diet, exercise and cancer. If you would like to find out more about the Supporting Families with Cancer project or attend a medical supermarket event, please email sfwc@le.ac.uk. That's the Supporting Families with Cancer project. Thank you for listening and goodbye.